Hello, everybody. My name is Deborah Dogba. Welcome to Afro Swag Media and Magazine. Today, we have a very special guest. His name is Dr. Benson Edagwa. I will bring him to the camera and then he will tell us who he is and the reason behind the live stream that we are having today. Hello, Dr. Benson.
Hi, everyone. Thanks for having me. My name is Benson Edagwa. I'm an assistant professor at the University of Nebraska Medical Center. I grew up in Africa. I obtained my bachelor's degree in chemistry from what is now known as the University of Eldoret in Kenya. Then after obtaining my bachelor's degree, I came over to the US to pursue my PhD in chemistry and graduated in 2012. Then after graduating with a PhD in chemistry in 2012, I joined the Department of Pharmacology and Experimental Neuroscience as a postdoctoral fellow. Then after that, I have risen through the ranks, and now I am assistant professor, engaged in numerous projects and also in mentorship of graduate students and postdoctoral fellows. So what I do at UNMC is I apply also my background in chemistry to finding better ways of treating and preventing chronic illnesses like HIV and hepatitis B. And we are recently starting to look at other conditions like coronavirus. Thank you.
Thank you so much for that introduction. It's an honor for us to have you today. And Dr. Benson, so you are also the principal author of major published biomedical papers. Can you please tell us about that?
Yes, so we've published a lot of articles. I can say I'm a principal author on more than 40 research articles. I'm also a co-inventor on 13 US patent applications. But some of the most recent breakthroughs that we had one major breakthrough sometime in July of last year, where we combined these long-acting and effective medicines together with a technology called gene editing to demonstrate that we could remove we could potentially remove HIV from a humanized mice. Then sometime this year, that was in April of 27th of April last month, we've also shown that we can actually change the way HIV is prevented or treated by designing long-acting medicines that would not only make it convenient for those that are at risk of being exposed to HIV, but also would allow those that are having the disease to take their medicines at a once every year on a once every year basis. So that is the major breakthrough that we had that we reported in Nature Materials last month, and we hope to move those findings forward.
Thank you so much. So, how many scientists were involved in that once every year medicine?
I'm very lucky, actually. I work with so many scientists, so I don't work alone. So for that project alone, we were 21 scientists. And it's not just the scientists that made that work possible. We also got support from other institutes like the National Institute of Health, because we know we need funding or resources to do our work. We are much grateful to Nebraska community, the way they support our work, and also our own University of Nebraska Medical Center, the way they've continued to support everything that we do on campus. So I would say it has taken many to accomplish that, to make that observation that we made. And we are still moving forward, and we just started new collaborations with other organizations like the Clinton Health Access Initiative, which are also working in collaboration with the other organizations like the World Health Organizations to make sure that when we have such effective treatments, they are distributed to where they are needed, or those that need them the most have access to such effective medicines.
Thank you so much. So, who were the lead researchers on this HIV medicine?
So I would say I was a co-lead or an MPI on this project. So I'm the only chemist in our group, but I work with a virologist who is also my chair of the department. So we were the principal investigators on this work. And then, of course, as I said, we were supported by other scientists. So I did the chemistry portion, designing the medicines and the formulas. And then they also, of course, designed the pharmacological system that looked at this, at the effectiveness of the medicines and formulations that were designed. So I was very lucky to be among the co-leaders of that project.
Thank you so much, Doctor. So, what was the inspiration behind it?
We know that HIV still doesn't have a cure. There is also no vaccine against HIV. So, but what we do know is that when patients consistently take their medicines as required by physicians, they're able to live with their conditions or to manage their conditions and just, continue living like any other person in the society. But the biggest problem we have is that, it's very hard to have people to take their medicines as required. This could be something to do with maybe just their work schedules, or some people forget to get to take their medicines. And when that happens, many of these effective medicines become ineffective because the virus continues to change its form, or it does what we call mutations. So a medicine that was life-saving at some point, it becomes ineffective, and we don't want that to happen. So that really inspired us because we knew these medicines are effective, and we know that those that take these medicines, those at risk of HIV infection, if they take their medicines, they're able to be protected from acquiring the disease. So we knew that we had the tools, but how do we make these tools more effective? So that is what really inspired us to look for something that could help us take those gains or the lessons and experiences that we have learned to the next level.
Thank you so much, Doctor. So, let me ask this question. Can a shot be used to prevent the HIV infection?
Yes, that's the immediate goal with the single therapy that we have, because with HIV you need more than one drug, because HIV goes through what we call a cycle when it enters the human body or the cells. So the way these medicines are designed are to target various stages of the virus life cycle so that you don't end up with forms or mutations of the virus that becomes difficult to treat. So, but when you have a single drug, like what we kind of developed, it's been shown that single drugs can be used effectively to prevent those without infection from acquiring the virus. So that is where we could actually see immediate benefit if this system is moved forward.
Thank you so much, Doctor. So, what stage of the research are you on currently?
I would say right now, research always goes through, it's a long phase. So you start with the discovery phase, and then you do some screening, and then of course you have to work in laboratory animals. Then you go to trials, you have to demonstrate the drug is safe, it's effective. So what we did was the discovery and proof of concept stage. But the good thing about this medicine, it's a known drug that is already used elsewhere. So we know the drug has been shown to be safe and effective. So what we did was just to make it even better or enhance its features to allow it to be given less frequently. Now, instead of it being given once every day or once every month, like what is currently being given in Canada, we have a version that could be given once every year. So we still haven't done any human trials, but that is, those are some of the things that we need to be thinking about. But before we even get there, we need to look at how do we scale up the process so that we can have enough drug to conduct those trials. And then also we need to establish partnerships. So there's just so much that still needs to be done, but we are very much determined to get to the finish line with the required collaborations and bridges and networks that will take what we developed here at UNMC to the next phase.
So let me ask you, Doctor, are there any other once every year treatment? And what does it mean for Africa?
Right now, as we speak, there is no antiviral medicine on the market, anti-HIV to be specific, that could be given once every year. But there is an injectable that could be given once every month that it has been approved or was approved for use in Canada. So the drug that we enhanced its features is one of the medicines that was recently approved for use in Canada. But as I said, it is given on a once every month basis. But we realize we can do better than once every month. So that the shortest answer to your question is there is no once every year long-acting antiviral therapy on the market, but there is a once every month that has been approved for use in Canada. So what we have, we believe, is going to be a game changer if it does what we hope it will accomplish.
Well, we'll take a quick break. If you're watching right now, please don't go away. When we come back, we'll talk about the coronavirus. Thank you so much and welcome back. So, Dr. Benson Edagwa,
Yes.
what should the population know about the COVID-19, the coronavirus?
I think what we need to know, I know there is so much information out there. So the most important thing for us to know is that the virus is real. We need to listen to what our governments and healthcare officials are telling us. We now know how the virus is spread or how it's transmitted. We know that there is no vaccine against this virus. There are many vaccines trials, but we don't have a vaccine yet. So what we need to know is we just have to continue following those guidelines provided to us by healthcare officials or by the CDC and other government agencies so that we can try to minimize its spread. And soon this virus will be behind us.
Thank you so much, Doctor. I have Akindele Akeyemi. He is the president and CEO of the Global African Business Association. I'll bring him to the camera. He has a couple questions for you.
Okay.
Thank you so
Hello,
kindly.
Akindele.
Hello, Deborah. Dr. Benson, great conversation, great information that you're giving. Thank you so much for being on the show today. I do have a couple of questions. You mentioned about um, therapy being
Yes.
taken month to month, but it's been approved in Canada. But my first question is, how come it hasn't been approved here in the U.S.? That's number one. And number two,
Yes.
with all the research that's gone into HIV research, after 40 years, are we even close to a vaccine anywhere being developed? Those are my two questions.
Yeah, so what we know about this monthly injectable that is currently approved in Canada, actually it was submitted to the FDA for approval at around the same time the medicine was submitted for approval in Canada. But FDA, there is a way that FDA does its process. So,
Okay.
but as what we know from what is out there or what the company put in the public domain is there was some kind of questions that the FDA asked around the chemistry and manufacturing techniques. So the reason for denial in the US was not, or delayed approval in the US had nothing to do with the effectiveness or safetiness of the drug. It had to do
Okay.
with chemistry and manufacturing process. So,
Mm.
looks at all those things prior to approval. They want to make sure that, when you start producing a drug, your supply is not going to be interrupted because you're going to put patients on a drug. Do you have everything in place to ensure that there is continuous supply? But I don't know
Hmm.
if that was one of the reasons, but I know that is something that some of these federal or some of these agencies look at prior to approval of any medicines. And then of course they will look at other things that will be communicated directly with the scientists involved in the work. So it's a very rigorous process, and it's something that could take anywhere from a year to more than a year, because you have to explain to the FDA agencies how the work was done. They have to look
Hmm.
at the data. They have to be convinced that this drug or this medicine is going to be safe. It's doing what you claim it's doing, because the goal of making these medicines is to save lives. So you don't want to create something that will create more problems. So we hope that this medicine will be approved in the US soon so that people can have access. Now
Okay.
you go to the other question of the vaccine. Yes, there's a lot of work in the area of vaccines that has been done in the space of HIV. But it's very unfortunate that we don't have any vaccine. We've had HIV for like 40 years, but there's no vaccine. Now,
Right.
is a very smart virus. It's not like these other viruses that we see, like coronavirus or these other coronaviruses or flu or polio. The virus itself, HIV itself, the way it outsmarts our bodies is its abilities actually to get into the DNA of the human, and then it knows how to outsmart or to fool the immune system. That way, our body's own defense mechanisms don't try to they kind of know how to exist or to live peacefully with the virus. Now, why don't we have vaccines against things like HIV? HIV, again, it's a rapidly changing virus, what we call mutations. It changes its shape so many times that you may be designing a vaccine to target a specific location of the virus, and then it changes its shape. So it knows how to change its shapes many times. It rapidly mutates, and that makes the entire process very complex. But thank God we have effective medicines that target the active phase of the virus, and those
Hmm.
medicines have enabled actually many HIV patients to live near normal lives. And also, there is enough evidence out there that shows that when these patients take their medicines as required and they're able to maintain the virus or the virus levels in blood to undetectable levels, they won't actually transmit to any uninfected people. And there is also evidence that shows that when those that are not infected by HIV and take the HIV, some of the HIV medicines, what we call pre-exposure prophylaxis, there is a pill actually called PrEP. There is evidence that shows that if healthy individuals take that pill and consistently ensure that there is sufficient amount of drug in their system to prevent infection, they kind of limit their chances of acquiring HIV infection. So there is
Got
just
it.
so much that we've gained in the area of HIV research. And I would say HIV right now, it's no longer a death sentence. It's a chronic condition. There are effective medicines out there that are currently being used to manage the disease. So what we have to do is to ensure that those medicines are given to those that need them the most. We have to continue to improve upon those medicines that we have. And we also have to go out there to interact with the patients or those taking those medicines or those at high risk of acquiring this infection to be able to know what are their preferences. What else can we do as we continue doing science to make them even more effective so that we
Hmm.
can all defeat this HIV? So we have the tools, but we just need to implement those tools so that we can
Right.
defeat this disease.
Thank you so
Fantastic.
much, Dr.
Thank
Benson.
you.
Thank you so much, Akinbele. We'll
No problem.
continue with the coronavirus question. So, Dr. Edagwa, when it all started, they
Yes,
said children may show less symptoms and have pneumonia and be playing. We won't even know, or
yes,
even be asymptomatic carriers. What's
yes.
your take on that?
I think the most important message here is for us to know that COVID-19 is real. And there is no evidence actually out there that shows that children are at high risk. But there is some information that shows that, children are not that affected. They can have they can have the virus within their bodies. They will show some mild symptoms, but we're still learning more. There is no evidence that shows that there is no evidence that shows that they're at high risk, or there's evidence that shows that they don't get infection. We know they get infection. So what we have to always remind ourselves that this virus is it's with us. We need to protect the kids from getting infected. We have to follow the guidelines, whether it's for kids or not. And of course, it depends on the age of the children, because you cannot put a face mask on a child that is under 2 years, but we have to make sure that they are protected. But the question whether kids can get infection or not is, yes, they do get sick, but they don't just, they're not severely infected as, adults at certain age, maybe above 60 years. And again, you can also have kids with underlying conditions or underlying illnesses. So when you're talking about those kind of groups, then the question now changes. So what we have to do is to constantly remind ourselves that the virus is with us. It can affect anyone. Everyone, could transmit unknowingly. So we just have to continue to follow those restrictions and guidelines to minimize spread.
Thank you so much. So, are there any extra precautions that you recommend today?
I would say we have everything that we need uh, out there, because when this virus began, there was just so much that was not known, but we've continued to learn so many things. I know people have been told, all of us have been told to wear masks in public. I think that's really important for us to follow that guideline. We've constantly been reminded to disinfect surfaces. We should follow that. We've consistently been told to wash our hands or use some of these, hand sanitizers that has 60% alcohol. We need to make sure that we follow that. We've been told to try to avoid, large crowds, we need to continue to follow that. So we have all the information that if we follow that, those guidelines that have been given to us, or those guidelines that are provided through websites like the CDC website, I think we should be able to do fine. And I know there are some countries that were really ahead of everyone in applying some of those restrictions, and we are starting to see that they seem to be working for them. So we should just continue to remain vigilant and follow those guidelines. And very soon, I think that this virus will be behind us.
We hope so. So, Dr. Edagwa, you are not just a scientist, you are not just a medical professional, you are also part of the African diaspora in the US. You are originally from Kenya. So,
Yes.
my next question is there any positive community engagement or achievement or any future ones that you have been involved with?
Yes, because I mostly come from the academic side, my involvement or engagement has been mainly in academia. So I would say I have continued to support many students from other countries, including Africa, to access education. I've continued to direct them. I've continued everything I can to ensure that knowledge is shared to support their education. And as we speak, actually, I am currently one of the board of trustees in one institution in Africa called the University of Eldoret, where we are trying to come up with programs like initiating centers for excellence, where we can have some of these research initiatives done. We have our own institutions come up with some of the challenges that the rest of the world is not facing. So those are things that we are beginning to do, or what we've done. And as I said, I've worked with so many students. Some of them have gone back to Africa. They are now either university lecturers, others are deans of colleges. So I started that when I was a student myself at Louisiana State University, and I've continued to do that. And any student that reaches out to me, they know me very well. I always offer support.
Thank you so much, Doctor. And for our viewers, if you have questions, we will take one or two. Please put it in the comment box and we'll make sure we address it. So, in closing, Doctor, any thoughts, any comment, anything you would like to add?
I would say all of us have an important role in life. We have just to make sure that we do the right things. That to me is what is really important. It doesn't matter, you know, how you contribute. Make sure that you give everything your best, whether you are contributing from healthcare side, whether you're contributing whichever way you are contributing. Just do everything that we do. We should give it our best, and we should always follow, simple guidelines. Like for instance, what we are currently facing, this pandemic, is something that none of us has seen in the past. So those are things that we should always try to follow, try to understand, and we should also not try to, stigmatize people, especially when we have such chronic conditions, because, when we have such misinformation going around, because, there are so many things I see out there. So we have a role. I see so much misinformation. People say things that are not accurate. So everything that we do, we have to consistently remind ourselves that, are we doing the right things? All of us have a major role to play.
Well, thank you so much, Doctor, for being with us today. It's a pleasure and honor to have you share some of the experiences and the researches that you're doing right now. We thank you so much. For the viewers, thank you for being with us today. Doctor, I know that you are currently at work. I will let you continue doing what you do the best. the researches, and thank you for being a role player and a leader and influencer in our African community. We are very proud of you. Thank you.
Thank you so much, Deb, and thank you everyone for your time.
Thank you. Bye-bye.
Bye.